So now let's get into actually designing the guide. Now that I have my implant precisely where I want it, actually I'm just kind of twirling around this because I'm making sure I really have it as so crestal as I want. Let's go over to the guide panel over here. And we're going to obviously be making this off of my Primescan of the lower model, which is already selected. And we're going to define our insertion. You can see where there's some undercuts. It's automatically kind of highlighting that in red. I don't care too much for undercuts on the left side because my guide's not going to extend over that far. That seems fine. I'm actually going to take this down to 0. That's how I've been doing it lately. I don't like it being too tight, but I will have to be holding it on manually with my fingers during the surgery. I want to make sure that I'm giving or defining the guide path here for my surgical guide. So, so up here, there is my icon for opening up my guide tube visibility, and I have the wrong drill kit on here. Actually, I used the blueskybio fully guided kit, which you can see made a small change to the way this is placed. And I need this sitting just like right above the tissue, which it is going down into the tissue a little bit over on this side. That's okay. What I really care about is making sure that this inner diameter circle doesn't come down and pinch on tissue, because I'm going to be inserting a metallic guide sleeve into this surgical guide. So that looks fine to me. There are some circumstances where you might have to raise or lower this, and that doesn't need to be done in this particular case. See right here, you can raise it. Now, if you do raise it, you'll have to switch which osteotomy drill that you're using, because you'll have to use a longer drill to obviously come to the same depth of your osteotomy site to get the same size implant in there. But this will work fine with what's defaulted. Alright, so you're going to come in here and you're going to see that when I hold down shift, that my icon turns into a plus sign. And I'm holding down that shift, and I am continuing to come along the bottom, and I'm going to come up and around probably this lateral incisor, and then just kind of right along the path of the cervical area or lingual side of these teeth. Come around, and I'm not holding down shift right now. Just kind of bringing this close by to where it's going to be. I'm going to hold down shift one more time on top of that next bead, and it automatically recognizes that I'm close by, and it placed it. I probably brought these down a little farther than I need to. And here we go. So one thing that you'll notice is that with all this bulky area on top of the natural teeth, I want to be able to verify that they're seating all the way, other than just looking at the end of it here. So what I can do is right click and hit this add window, which just gives you this square that you can modify the size of. Typically you'll want it to extend beyond the boundaries of the buccal lingual dimension. I don't need it to be as thick as that was. Move it over here. When I create the surgical guide, it should have this little window in here. And actually, I may be able to ask it to create a surgical guide again. And this way, it will actually remove that portion so I can see the natural teeth underneath if it's seating fully. So there you go. So now you can see the teeth underneath. That will help me verify that it's seating fully. I usually plug in the names of the patients over here. I'll engrave them in. Just helps me identify them amongst all the 3D printing that I do. And I usually put the implant size. And I just kind of move my this image down here. I can zoom in. That will actually make the text smaller on the tooth, and if I do this, it'll make it larger. And I usually just try to put it in an area that doesn't really in the way of anything. Seems fine. We're going to apply. And there we go. I have the patient's initials and the implant size plugged in here and ready to go. So I'm going to export this. It does cost to export these. So I'm going to come up here, export my data. Over here, there are two checks. One is for export I, which is for the implant, and this one is for the guide tube. And I believe, if I'm correct, this one actually is a superimposing digital, like that donut from the surgical guide tube. I may want to uncheck that. So over here where I originally checked this, if I uncheck that, you'll come down here and see that that's no longer superimposed in my guide anymore. So there it is, superimposed. There it is, off. So now when I go through to my export data, you'll see that, so I was wrong. So that guide tube, that's now unchecked. So that's not what I want to have on there. I just want, in fact, I don't even know why the implant's on here. I don't want to export the implant either. I just want the tube itself. So this is the only thing that should be checked mark. If I come down here to export it, you know, I have so many exports remaining. The cost is 1. So you export this and it gives you your STL file that you can import into your desired 3D printer software. In my case, it'll be Rayware for my Sprintray 95. And my surgical guide material, which is the surgical guide 2 from Sprintray. That they have a surgical guide 3 right now, which is nice, but I'm trying to burn through the rest of my surgical guide 2. So that's pretty much it. You know, ask me any questions. I'll try to respond. Like the video if you liked it, and make a comment. I'll try to respond. Thank you for watching, and I will have more content later. Have a good night. Bye-bye.